Assalamualaikum and hi everyone. My name is Farah Maisarah binti Rauf. So today I will present to you guys about scoliosis. Have you heard about scoliosis before?
Yes,
Oh really? So what did you know about scoliosis?
can at this point?
Yes, you are right. I think you guys are excited to hear about the details on scoliosis. Let's dive into it. Are you guys ready?
Yes.
Okay, so I will start with the introduction first. The first one is, what is scoliosis? Scoliosis is the abnormal side-to-side curvature of your spine. For your information, our backbone or spine are naturally curving slightly forward and backward. If the person was diagnosed with scoliosis disease, their spine will curve in a C or S form, either to the left or to the right. These are the pictures showing how the C-shaped curve looks like, which is it curves to the left, while the S curve shape looks like the S letter. These are the picture, as you can see. Okay, so we continue for the type of scoliosis. Basically, scoliosis have four types. The first one is idiopathic scoliosis, means it can happen without any unknown reason. Next, congenital scoliosis. Okay, let me ask you first, what is congenital means?
Disease that present at birth?
Wow, you are so very intelligent. Yes, which means this spinal abnormality had been detected at birth. Number 3, thoracic insufficiency syndrome means lack of spinal growth is caused by the presence of fusion of the spinal abnormality. And last but not least, a neuromuscular scoliosis usually happen at nerve or muscular condition like cerebral palsy and spina bifida. Moving on to the classification of scoliosis. The first one is infantile scoliosis. It started at the age below 3. Next is juvenile scoliosis. It started at age of 4 until 10 years old. And adolescent scoliosis, which is start at 11 years old through 18 years old. And lastly, adult idiopathic scoliosis, which is any scoliosis that can happen after age of 18. These are the picture that I put, which is you can see adolescent scoliosis and infantile scoliosis, which is their X-ray imaging. Okay, so I will continue my explanation about etiology. Etiology will explain about the cause and the origin of the disease. Before I discuss about the cause and the origin, did you know what can cause scoliosis?
Bad body posture. Accident.
Yes, that's right. Because usually scoliosis can happen because of bad body posture. Current days. Okay, so these are the reason why scoliosis can happen. The first one is bone marrow can derive from the own stem cells, and it can result to bone mineral density decrease and may regulate bone mass formation. Next is genetic. Chromosome epigenetic changes resulted from environmental factor and resulting to the dysfunction of cell activities. Environment and lifestyle also can cause this cause of scoliosis because of the high environmental selenium, which is the essential toxin like water, plants, and atmosphere can induce uncoupled signal like neuroosseous growth, the overgrowth of the spine relative to the spinal cord, resulting in the spine curvature. And last but not least is hormones. When the person is lack of estrogen, it can lead to deficit of the bone maturation. We move on to the origin of the scoliosis. So I will explain this origin into the specific types, which is the first one is idiopathic. Idiopathic, the origin is no causal agent or any association with other disease and cannot detect any cause. For the neuromuscular, it is underlying myopathic or neuropathic illness that causes an imbalance in muscle tone without any prior anatomical or congenital abnormalities. For the congenital, it's defects during vertebral development. For example, like asymmetric growth of the spine of thoracic cavity. And lastly, syndromic. Syndromic is clinically definition is the definition of syndromic is multiple symptoms that constantly occur together. But in clinical, it defines a pattern that is associated to scoliosis. We move on to sign and symptom. Okay, so I would like to ask you guys, what are the common symptoms of scoliosis?
Back pain. Cannot stand for too long.
Oh, that's right. For Gina, that's right, the symptom. But for Ariana, it can be the symptom or the sign. Like if anyone that looking at that we cannot stand it for too long because of the scoliosis disease. Okay, so I will explain about the sign first. Sign is basically the things that medical doctor will assess if they want to do the assessment about the scoliosis. The first one is the uneven shoulders. Uneven shoulder, which means shoulder right either too high or too low than others shoulder, and it can goes to the shoulder left too. And one of the shoulder blades also that can stick out. Head that doesn't center above your pelvis, and uneven waist and elevated hips. If I didn't know that if you guys are watching the chiropractor, I think the TikToks is viral currently. They always check if the person wants to always complain they have a back pain or something. They as a medical assistant will check their shoulder, their waist, their hips to confirm that if the back pain is come from the scoliosis or not. Okay, so for symptom is basically what is the person feel or the person of the patient feel. The first one is back or leg pain. It can cause because of the asymmetric and is usually pain at the apex of the curve. And second, limitation in standing, sitting, and walking for a long time. This can happen if the curvature of the spine about 40 degrees, and it can become more severe, constant or frequent pain for the patient. And last but not least, upper spine pain and fatigue everyday life. Because if everyone do not like any feel discomfort or something, so if they feel discomfort around their body, it will affect their social activity and give them feel fatigue or pain like that. Okay, before I'm moving into the imaging modalities, are you guys still there?
Yes, we want to know more. Agree.
Okay, so I will continue to explain about imaging modalities. So basically, I will exactly explain only three, which is the X-ray, CT scan, and MRI, because that is the modality that usually used in to examine the scoliosis. Let's start first with the X-ray. So these are the advantages from the X-ray. The first one is X-ray is very suitable to use for early stage monitoring because they do not much as other modality like CT scan or MRI. Why? I will give you a reason just a little bit. Okay, and but and then it can monitor of the severe of scoliosis with high level of sensitivity because from that the doctor can count the degree of the angle, which is it's severe or not. For the disadvantages, it's limited in their ability to assess vertebral rotation and pelvic parameters because we all know that X-ray machine cannot rotate like for the whole body, like they do not have slice or something, just rotate in limited rotation, so it will have a problem to analyze the whole spine, and that can cause inadequately capture the image. Okay, for the specific characteristic, only X-ray machine can help the doctor to count the Cobb angle measurement. So what is the Cobb angle measurement? Cobb angle is the main quantitative method for determining scoliosis severity. And the next one, from the X-ray we can analyze the curve pattern and vertebral rotation. So X-ray typically show lateral curvature along with vertebral rotation towards the curve concave side. It helps to identify its curve, whether C curve or S curve. Okay, so we'll move on to another modalities. The CT scan. Okay, so the advantages of CT scan, it can determine of the pedicle thickness of vertebral body. It's basically for screw replacement during the surgery. Moreover, it's for detection of osteostability and growth limiting anomalies, such as hemivertebrae or congenital vertebrae defect. But the limitation, it has a greater radiation. Like I said before, X-ray do not have any much radiation like CT scan or MRI, like CT scan, because if you guys want to know, one CT scan similar to 300 examination of X-ray. They are those. So, and CT examination in childhood have been shown to increase the risk of leukemia and triple risk of developing a brain tumor. So, for specific characteristic, we can, from the CT scan, we can assess of adjustment of adjacent structure. CT scan can identify the relationship between the spine and surrounding structure clearly, such as rib, which is useful to case where scoliosis impact and thoracic anatomy or function. For 3D reconstruction, it provides a comprehensive view of the spine curvature and rotational deformities. And for the last modality is MRI. Okay. For the advantages of MRI, it can reduce radiation and lower preoperative risk. It can also detect. Okay, why I say it can reduce the radiation? Because MRI gives the meaning with magnetic resonance, so it's only use magnetic to do the examination. It's not use any radiation. Okay, so for the detect malformation of the brainstem, myelin, and nerve, because MRI can well differentiate the soft tissue very well. For these advantages, if the younger patient, the lower the fat content in the bone, so it's difficult for the doctor to differentiate their bone and fat content. And MRI cannot use for surgery, and also is very expensive compared to other CT or X-ray. For the specific characteristic, it's identify degeneration and soft tissue. And it's also capture image in sagittal and axial assessment. MRI also can perform the sagittal T2-weighted image through the apex of the curve and through the lumbar spine. The coronal T1 weighted images are all useful for demonstrating if the chord is single for assessing the shape of the scoliosis. Okay, so I will ask you guys, what do you think the best modality and why?
History? Because it's suitable for early assessment.
Yes, that's right. Okay, so best modality goes to X-ray. It is because it's affordable and less radiation. But if you know, the scoliosis need to do a repeated examination. So the first examination will do in AP projection, but other follow up will do the PA projection because we want to protect the the breast and the gonad from the radiation. Okay, other than that, I will just talk about the cup angle measurement, right? So, the cup angle is can measure angle between end plate and the most tilted vertebrae at the top and bottom of the curvature. And also it can detect the curve is mild, moderate and severe, which help to do braces or surgery. Okay, so do you guys have any question?
What is the degree for mild, moderate, and severe?
Okay, so for mine it's 10 to 20 degree. For moderate, 20 to 40 degree. For severe, it's more than 40 degree. Okay, so I will continue with the complication. So for complication, which is the effect of the effect for scoliosis. Okay, so the first one is long-lasting pain. They will feel the pain is 24/7 days. And mobility issue, they have a problem to do the social activity like walking, traveling, and lifting. Organ damage, for example, like the associated organ, the adjacent organ, which is heart, it can compress, it can it can leads to the hypertension of if the degree of the curvature is more if around 70 degree, and number 4 is nerve damage. If the spinal cord compression, it can cause the pain, numbness, weakness, and if the worst scenario can happen, it can impair motor or sensory function. And the last one is respiratory problem. The respiratory can cause the hyperoxemia. It can drop the oxygen level because of the limited ventilation. So I will explain about the radiographic appearance. So this lateral radiographic. So we can see the thoracic dextroscoliosis and the scoliosis there. Thoracolumbar level scoliosis. This patient, in my point of view, it have the S curvature. Next, this AP, I'm sorry, but okay. This radiograph in AP projection. As you can see, the A is the apex at T11, and the N is a neutral curvature, and E is the end of vertebrae, and S the stable vertebrae. This patient, I think, has the C curve. Okay, we come to the last part, which is technical consideration. These are the things that the radiographer needs to be aware if they want to do the examination for the patient. The first one is patient positioning. Of course, the patient needs to be erect and distribute their weight on both feet. Hand need to be adapted. And for the exposure setting, the KVP should be 80 to 90 PA. And for the lateral, 85 to 95 kVp. But it can vary based on body types of the patient too. The MAS should be used 40 to 60 MAS. For the imaging protocol, the radiographer needs to collimate the area of interest, do a PA, AP, and lateral projection, wear the shielding for patient, and use grid because we increase the MAS 40 to 60. And cassette use is 35 times 43 centimeter, which is good to capture the whole spine image. Okay, so before I summarize all my presentation today, do you guys like to ask anything about scoliosis?
Sorry, can I ask how much percentage relation diagnosis scoliosis?
For the latest year, which is 2024, only around 2 to 3% of the population in Malaysia was diagnosed of scoliosis disease. But scoliosis is may be hard to detect because like our generation always have a back pain now. Okay, that's all my answer. Okay, so I will summarize my presentation today. Okay, in conclusion, we have discussed everything related to scoliosis and understand which modality we can use for the proper diagnosis, to get the proper further examination that can be done. We need to diagnose properly. We need to choose the modality properly because if we do not choose the modality properly, we can misdiagnose from the result. Hence, I hope both of you guys gain something and new knowledge, which is scoliosis, and can you apply this knowledge in the future. Thank you for lending me your ears and attention. Have a nice day, everyone. Assalamualaikum and bye-bye.